Hello, and welcome back to another live training. Today, what I want to do is tackle one of the most common questions that I get from my clients who are, it mostly comes from clients who are newer clinicians. So, that question is, what tips do you have to be a good CI? Okay. I love getting this question for a lot of reasons. Number one, it tells me that this new clinician is committed to creating a great experience for their student. Number two, it tells me that the new clinician actually cares about sharing their knowledge. They want to do a good job. That's why they're asking. They want to teach this student. That's why they're asking how to be good at it. And the third reason that I love getting this question is because I absolutely loved being a CI when I worked full time in the clinic. It's essentially what led me to create Clinical Connections Mentoring because it was a way for me to continue to work with students and newer clinicians by helping them to just connect the dots through application and clinical reasoning outside of the classroom. It let me do, let's connect the dots. Let's think through all this in the real world with real patients, not just a textbook case in front of you. So, those are the reasons why I love getting that question. What tips do you have? How can I be a good CI? Okay. For anybody new that is watching here, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that there is for PTs. I have done acute care. I've done a lot of outpatient. I have done home health. I've done pediatrics. I've done oncology. Most of my career was in skilled nursing facility. I was a rehab director at a skilled nursing facility for a while. Um, and now what I do is I own my own cash-based practice here in Florida, and I'm also the owner of Clinical Connections Mentoring, which is where you are today. So, what I'd like to do before we get into all the details of how to be a good CI, if you are watching live, please type live in the comments. Tell me who you are, where you're watching from. Same thing if you are watching the replay, whether you are watching on Instagram, whether you're watching in the Facebook group, the Clinical Connections Mentoring Facebook group, or if you're watching on YouTube. If you are watching the replay, please just tell me replay, tell me who you are, where you're from. I just like to know who I'm talking to. Like I said, the goal of today's live training is to share my top tips on how to be an effective CI to help you have confidence as a teacher and so that your student can have a positive clinical experience by learning from you. So let's start with understanding the fact that you have to have worked for 1 year as a clinician before you can take a student. Okay. You can't, oh, I've been a clinician for 3 months. I'm really good. I'm confident. Let me take a student. And you have to have 1 year of clinical experience under your belt before you can take a student. The APTA does have a CI credentialing course that can be helpful, but it's not necessary and it's also not required to be a CI. They have a level one course and a level two course. Um, both can help you prepare for taking a student, but again, it's not needed to be a good CI. It mostly kind of helps you figure out what to do in those really difficult situations. If you have a difficult student or tough situations. So, like I said, it can be helpful, but it is not necessary to get the APTA CI credentialing. Okay, I do have it. It did help me figure out some things to do in those tough situations, but again, it's not necessary. So, a very easy place to start when you are ready to take a student is to remember your time as a student on a clinical. So, everyone has had positive and negative experiences with the CI. So, if you think back to your clinical experiences, what did you like about your CI? What did they do that was really helpful for you? And what did you not like about your CI? Did they do anything that hindered your learning or made for a bad experience for you? So, if you can think back on your own experiences, this can really help you define the type of CI that you want to be. In all my clinicals, I had a total of one, two. I had a lot of split clinicals. I had one, two, um, three, four, five, six, seven CIs, eight CIs across three different clinicals. So I had a lot of experience to pull from, and there was a lot of stuff that I loved about my CIs, and I took what they did and I used that in learning how to be a CI myself. And there were some standout CIs that I did not like that had created very negative experiences for me. And those are the things that I learned not to do. I chose, okay, I'm not going to be like that CI. I'm not going to say those things to my student. I'm not going to treat my student that way. So if you can really think about, just reflect on your time as a student. What did you like about your CI? What did you not like about your CI? What did you, what made for a really good experience for you and what made for a really bad experience? The things you like, do those. The things you didn't like, don't do those. Okay. Um, Once you've got that all figured out, you can build from here. Okay. So tip number one is to teach. Students are not there to be free labor for you, for your clinic or for your facility. They are there to learn from you, so teach them. I will get on my pedestal every day for the rest of my career to say this about clinicals. Okay? This is my number one pet peeve and one of the things that frustrates me the most about all clinical education. Okay, you can't always control your CIs, right? I'm talking to students right now. You cannot control your CI, but if you are a CI, your job is to teach that student. They are not free labor. They're not there to do your job for you. They are there for you to teach them. So you have to teach them. Okay, your job is to teach that student how to take everything that they've learned in the classroom and put it into practice in the real world. Now, just because they've completed their coursework does not mean that they're ready to be set free and sent to the wolves, right? They have so much more to learn when they get to the clinic, and that's where you come in. Okay, this is not your chance to sit back, take a break while they do the work for you. If you've agreed to take a student, this means you've agreed to teach them. So yeah, at first, this is going to create a lot of work for you. You got to teach them how to do everything. You got to teach them the clinic, the documentation, how all the systems, right? It is going to be a little bit more work on the front end, but over time, this does balance out, and eventually, the student takes over that full caseload. And you're there. They are doing the work at that point, but you're still there teaching them and guiding them. Do not be a lazy CI. The student deserves to be taught, and that comes from you. Okay. Tip number two, communication is key. This is absolutely necessary for a student to have a successful clinical experience. If you do not communicate with your student and they do not communicate with you, the clinical is going to be very bumpy. You have to communicate with the student, okay? And you have to do it effectively and very frequently. So you need to understand everything you can about the student in order to teach them effectively, right? So in order to understand them, you need to talk to them. You need to ask them questions. You need to know how do they like to learn? What are they like? Where are they comfortable? Where are they uncomfortable? What knowledge do they have? What knowledge are they seeking from you? What do they want to know more about? Where are they not comfortable? Where are they really nervous when it comes to specific patients or diagnoses? You need to know those things. You need to understand their expectations and they need to understand your expectations. Okay? So you have to communicate with your student. You also need to communicate with the student in order to understand their clinical reasoning and their thought process, right? This also helps to keep your patient safe too, right? So if you're not communicating with them, how do you know what they're thinking or their reasoning or why they're choosing certain things? You have to talk to them, okay? But you both have to communicate with each other, right? It's not just you communicating with them. They also need to communicate with you. But being open with your communication is going to ensure that you are going to be an effective CI for that student. Okay. Now, communication with the site coordinator as well as the DCE of the school is also very important. They are your resources if things get tricky or difficult with your student, right? They can help you figure out how to navigate a challenging situation. They also need to know how the student is doing. So they're going to ask you questions. You need to inform mostly the DCE how that student is doing. So open communication with the school can really help you immensely when you have a student, okay? And they, like I said, they're very, very helpful when challenges start to arise. So maybe the student's not doing great and you don't know how to help them, they're going to help you with that. There's a pretty serious issue with the student, the DCE and the SCCE can help you with those things. So you have to communicate with the student. That is very, very important if you want to be an effective CI. But you also have to communicate with the school. Okay. Tip number 3, do not clone yourself. Okay. Being a CI is not about cloning yourself, right? It's about helping a student learn to think, right? You may think you're the best thing since sliced bread, and that might be true. But your job is not to clone yourself because there are different ways to do something, especially in the PT world, and still have positive outcomes with patients. Okay. So instead of trying to clone yourself by telling a student to do it exactly how I do it, right? You're going to be much more effective by helping them figure out their own way. Okay. So this applies to the flow of their evals, how they document, how they set up their schedules, how they choose interventions, how they come up with different exercises. All right. You can provide them guidelines, right? We still want the patient to be safe. We want the student to be safe with their patients. So you can provide them guidelines, but let them do what works for them, right? The easiest example is the flow of an eval, right? You've set up your flow the way that you like it. You test certain things in certain orders. You ask certain questions in a certain order because that's what works for you. It works for you. Does not mean it's going to work for your student. Their brain works differently than yours. So give them guidelines, but let them create the flow of the eval that works for them. Okay. You can share your experiences, you can share your thought processes, but let them develop their own thought processes. Okay. All this to say, don't tell them exactly what to do. Let them think through the process on their own. So, this is similar to like passive range of motion and active range of motion, right? With passive range of motion, we're doing all the work for the patient. They're not developing anything, right? With active range of motion, the patient is now doing the work. They're figuring out how to move their own body. Same applies to a student. When you tell a student exactly what to do with each patient, you're just cloning yourself. The student is getting passive education. They're just going to start to mimic you. When you let them think through through things, let them develop their own thought processes and reasoning skills, they're now processing the information and actively learning, and this is where true learning happens. Okay? This is what makes a strong clinician. This is what makes you an effective CI. So try to stay away from telling your student exactly what to do. Give them a safe environment to help them figure it out for themselves, and you guide them along the way. Okay. Tip number 4, it's okay to not know something. Okay. New clinicians are often still finding their own footing. Okay. So I'm talking to the new clinicians here who want to be CIs. It's okay to not know something, right? So taking a student can sometimes feel very intimidating and a little bit stressful. You'll have thoughts of what happens if I don't know the answer to their question, or what if I don't know what to do with a patient that ends up on our caseload, or what if we get a diagnosis that I've never heard of, right? These are very common thoughts and fears, and they're also valid, right? Because yes, all of this can happen when you have a student. The best thing to do here is to be honest with your student, okay? If you don't know the answer to something, tell them you don't know. Tell them you're going to look it up. Tell them to look it up, and then you have a discussion about that topic the next day. Okay? This is the perfect time to give your student homework, right? This helps your student learn, and bonus, you get to learn too. Okay? Some of the best things I have learned as a clinician have come from my students teaching me something. Okay? In addition to all of that, the bonus of you getting to learn something, the student gets homework, you get to learn something. The student is going to respect you so much more if you are honest with them rather than trying to fake it. Okay. This also teaches that student that it is okay to not know everything, right? One of the biggest struggles that students experience is the belief that they have to know everything. So, by setting the example that it's okay and normal to not know everything, we can already start to ease some of that unnecessary expectations that students tend to place on themselves. Okay. So it's okay to not know everything, and it's okay to to teach your students that it's okay to not know everything. The next thing you teach them is if something comes up that you don't know, how do you find the answer? Okay. So to sum all of that up, if you want to be an effective CI, make sure that you are ready and willing to actually teach your student. If you're not ready, if you feel too stressed out, in your own caseload that you don't feel like you have the time to take a student, you do not take that student yet. So you have to be ready and willing to actually teach the student. Two, make sure that you are communicating early and very, very often with your student. That is really the key to the success of being an effective CI. Make sure that you're teaching your student to think and you're not just cloning yourself. And make sure that you are comfortable with not having all of the answers and being honest with your student about this. Okay. So, like I said earlier, I get this question a ton from my clients. And because I get that question a lot, there's so much more of this topic. I go into a lot more detail. I have tools in my complete clinician program. So I provide information, I have examples, I help my clients with their specific situations and one-on-one calls when it comes to taking a student because every experience is different for the CI and for the student. So I spend a lot of time within my program helping clinicians figure out how to be a really effective CI. Okay. So if you are interested in learning more about that, what the program looks like, or how I can help you, feel free to send me a message, drop a comment below. You can DM me, however you want to reach out to me. Go ahead and do it. I would love to chat with you. Taking students is one of the most rewarding parts of our profession if you're really into teaching. And if you have that itch to take a student and you haven't, and you've listened to this entire video so far, then you're probably going to be a pretty good CI. But if you want to know how to be effective, that is evidence enough that you care, right? If you find yourself, how do I be a good CI? If you're asking yourself that question, that's already enough evidence that you care. And it's evidence enough that you are committed to helping that student develop into a great clinician. But if you want a little bit more, you want to take that extra step in learning how to do that, I got you. I got your back, right? Reach out. I would love to help you. Okay. I hope you learned something new today. Please go ahead, drop your questions, your aha moments, or something that really stood out for you. Drop it in the comments below. I want to thank you for watching, whether you're watching on Instagram, whether you're watching in the Facebook, or if you're watching on YouTube. If you have any questions about what I talked about today, please feel free to message me or just drop your questions below. I will definitely come back and answer them. I will see you next time. Have a great day.